The Health Ministry has reactivated the Public Health Preparedness Clinics, or PHPCs, to better manage and detect COVID-19 infections at the primary care level. So starting next Tuesday, hundreds of GP clinics will provide subsidized treatment, investigations and medication for patients with respiratory symptoms. Cheryl Goh reports.
Fever, cough, runny nose and sore throat. The Public Health Preparedness Clinics will care for patients who show such respiratory symptoms. Singaporeans and permanent residents will also receive special subsidies when they are diagnosed with respiratory illness. By reactivating the PHPCs, the government enhances disease surveillance and reduces the risk of community transmissions.
Our primary care plays a very important role in helping us to detect and manage patients, including those who have been infected with COVID-19. But it is also important for them to also look at other illnesses. We have something like 30,000 patients a day with respiratory symptoms.
PHPCs have been activated in the past during the H1N1 influenza pandemic and during bouts of haze. This time round, 900 designated GP clinics will be progressively activated from next Tuesday to provide care for patients with respiratory symptoms. They will be given clear guidance on the appropriate care protocols to assess the risk and diagnosis of each patient. The staff will also be given personal protection equipment such as gowns, masks and gloves. The task force says this is a step up in its containment efforts, especially after the Health Ministry has also observed that many of the local confirmed cases had continued to move about in the community or go to work when they were ill.
So that we can intervene early in the infection and detect and pick up more cases. It is clearly emerging now that COVID-19 is different from SARS. The transmission mechanism is closer to H1N1 or influenza. And our own researchers looking at the cases within Singapore have confirmed this. Because like influenza, they have found that COVID-19 is infectious when the symptoms are mild. Because of this transmission mechanism, it is also the case that COVID-19, like influenza, can spread quite quickly. In terms of severity, COVID-19 is also different from SARS, and we've said that before. If you look at the mortality rate in China, overall it is lower than SARS. Outside of Hubei province in China, it is even lower. Outside of China, it is low too. So mortality rates are lower than SARS.
MOH has since given guidance to doctors to give patients with respiratory symptoms 5 days of sick leave to give them enough time to recover.
We looked at also the normal duration in which patients with respiratory problems recover from the illness, and the majority of people would in fact recover within 3 to 4 days. Having therefore a little bit of extra period to allow them properly to recover, it allows us also then to look and determine whether there are other patients who still are not getting better, who might be getting worse.
The task force also reiterated that Singapore has no plans to raise the disease outbreak response system condition level to red at this point, nor is the country at the stage of switching containment strategies.